I suffered for over a year with intense pain in my upper right abdomen area. I didn't look forward to eating, and I love to eat. I did have sludge in my gallbladder, and it was determined that I needed to have it removed.
I was motivated to get into medicine because I love helping people in any way, and I love using my hands, so a surgical specialty in medicine was a winner for me.
When I met Dr. J, I thought to myself, you're like the big brother of Doogie Howser. He looks so young, and yet he's not as young as he looks. He does have great experience.
Cholecystectomy, the removal of gallbladder, is one of the most common operations a general surgeon performs. And the standard of care for the last 2 decades for this operation has been to perform this laparoscopically with at least 3 to 4 incisions. The robotics version of this procedure allows us to perform this particular operation with just a single incision through the belly button. And after the operation, within 2 weeks, you can almost not see the scar.
He reassured me, gave me comfort, explained the procedures that I was going to be having, and what the final outcome would be, and he was spot on.
The added benefit of the robotics technology is it allows you to visualize the organs that you're operating on in a 3D fashion. What I view as the surgeon is similar to watching a 3D movie, and I actually have depth perception.
I was really impressed with specialists in general surgery, and specifically with Dr. J and his nursing staff. They provided wonderful follow-up to me before surgery and after surgery. I was able to call and get those answers to relieve any anxiety I had about having surgery. The day of my surgery, they provided the right meds for me to be really prepared for surgery, so that I did not have a nausea after surgery, that they managed my pain really well.
On the day of surgery, the patient asked me what she should expect as far as post-operative recovery, what she would be able to do that night, and what she would be able to eat.
The thing that impressed me the most, the nursing staff showed great admiration and respect for Dr. J. And I could tell by the way that they interacted with him how much they liked working with him. And that helped build my confidence right before surgery.
Janet left the hospital within 6 hours after the operation once her nausea and pain control were up to par.
I was amazed at how fast I recovered. I'm a hockey player and I love to exercise. I enjoy jazzercise and biking, working out, going for a brisk walk with friends. And I was able to get back to all of that within 3 weeks.
The patients after the operation have much less pain because the single incision I make through the belly button is much less painful than the incisions that I used to place underneath the rib cage that a lot of times would irritate them.
I did not have any incisions on the outside other than my belly button area, and I was able to get back to my regular life and enjoy eating again.
Within 2 weeks after surgery, Janet no longer had the similar symptoms as prior to surgery of nausea, bloating, and diarrhea.
If you're a patient that needs surgery, I encourage you to look at specialists in general surgery. Thank you, specialists in general surgery.